Meet Aine. She has been taking antidepressants every day for 3 years. But recently, she lost track of her pill bottles and ended up missing her dose for several consecutive days. Logic suggests that if you stop taking a medication designed to treat sadness, you will simply return to a state of sadness. Instead, the immediate reaction is intensely physical. It often starts with a bizarre sensation known as brain zaps, literal jolts of electricity that feel like they are shooting directly from one side of the head to the other. Following those electrical misfires, the body can quickly develop severe flu-like physical illness, accompanied by sudden surges of extreme, uncharacteristic anxiety. Doctors identified this specific cluster of physiological reactions as a distinct clinical condition called antidepressant withdrawal. Abruptly stopping this medication triggers a violent physical and electrical crisis, forcing a body accustomed to chemical stability into an immediate state of neurological emergency. To understand why a missed dose hits the body so hard, we have to look closely at the microscopic environment inside the brain over those 3 years. The primary job of these medications is to alter and then strictly maintain specific elevated levels of neurotransmitters. This creates an environment where the neural pathways are subjected to a steady daily influx of chemical regulators. Because the brain is highly adaptable, it physically remodels itself to deal with this chemical abundance. Over thousands of days, the neurological architecture adjusts completely. The brain no longer registers this elevated state as artificial. The daily medication functions as a load-bearing pillar. It is a structural requirement for the brain's new normal operating ecosystem. That delicate ecosystem is thrown into chaos the exact moment a patient goes cold turkey and stops taking the pill. The brain's physical architecture remains modified. It operates under the absolute assumption that the artificial chemical influx will arrive exactly on schedule. When the drug does not show up, it leaves a sudden neurological vacuum. The remodeled brain is instantly starved of the chemicals it requires. The circuitry attempts to fire normally, but the signals fail to bridge the now empty gaps. This microscopic failure is exactly what causes the phenomenon of brain zaps. You are quite literally feeling electrical signals glitching and short-circuiting across your head. That localized electrical failure quickly cascades into systemic chemical chaos, triggering the sudden onset of phantom flu symptoms and overwhelming spikes of anxiety. Going cold turkey forces a physically modified organ to operate on a severe chemical deficit, ending in a widespread system crash. The initial shock of those first few days is alarming, but the long-term prognosis of sudden cessation is where the data gets concerning. A clinical analysis published by Stockman and colleagues specifically investigated the duration of these withdrawal symptoms. This timeline chart compares standard assumptions against the clinical reality. While you might expect withdrawal to last a few days or weeks, the data shows these symptoms can actually persist for 2 years or more. The recovery period is so extensive because the brain needs a massive amount of time to physically unmodel the structural changes it spent years building. Abruptly stopping medication risks triggering a chronic, multi-year neurological crisis rather than a brief week of discomfort. Because of this risk, there is only one clinically recommended protocol for discontinuing antidepressants: tapering. A taper avoids cutting the cord completely. Instead, you slowly step down the dosage in tiny, precise increments over an extended period. This descending staircase graph shows how a tapering medication dosage drops slowly. At each tiny step down, the synaptic receptors gradually regrow and safely return to their normal size. This slow reduction provides the biological time the brain requires to reverse its adaptation safely, finding its natural baseline without misfiring. Antidepressants physically reconstruct the operating environment of the human brain. Therefore, the medical strategy you use to exit the drug is as vital as the decision to start taking it in the first place.